Hello, my name is Alyssa Clements Hickman, and I am in the Counseling Psychology doctoral program at the University of Kentucky. And this poster presentation is about my dissertation, which was about therapists' personal characteristics as predictors of client-rated working alliance and treatment outcomes. So previous research indicates that therapists make an important contribution to client outcomes and that they can contribute anywhere to 3 to 15% to client outcomes. Therapists are primarily believed to make this contribution via their interpersonal characteristics, specifically their facilitative interpersonal skills, their warmth, their empathy, their verbal fluency can serve to enhance the therapeutic relationship, which we know makes an important contribution to client outcome. Interpersonal characteristics are closely intertwined with intrapersonal characteristics, which are someone's beliefs about themselves. And this is because intrapersonal qualities are going to drive someone's behaviors and the way that they interact with someone else. And for that reason, various intrapersonal characteristics have been very prominent in the psychotherapy literature. One construct that has been looked at pretty recently is professional self-doubt, which refers to doubts about one's ability to effectively help clients. And previous research actually indicates that higher levels of professional self-doubt is associated with more favorable outcomes. But professional self-doubt actually seems to be pretty inconsistent or incongruent with other constructs that are we believe to be important, such as counseling self-efficacy, which is one's beliefs about their ability to effectively help a client in the near future. Given the importance of these two constructs, it seemed important to look at both of these within one study, which had not been done before to my knowledge. So the way I constructed my study was I collected data from Southwest Behavioral and Health Services, which is a multi-site clinic in Phoenix, Arizona, serving clients who identify as low SES. For participants, I had a total of 46 therapists participate in the study. Therapists who were eligible to participate were invited to during staff meetings. What made a therapist not eligible to participate in the study was if they did not have any closed therapy cases, because I was looking at archival client data, or they did not serve clients who were at least 18 years of age or older. Also, if a therapist had only been at the site for a short amount of time, they likely did not have enough client cases that were closed to be able to participate in the study. As far as the clients that I ended up with in the study, a total of 1,817 clients were seen by the therapist who participated in this study. Therapists who agreed to participate in the study completed a measure of counseling self-efficacy and professional self-doubt. The counseling self-efficacy measure is a 37-item measure on a 1 to 6 point scale, and the professional self-doubt measure is only a 5-item measure. Once the therapist completed these measures, they also gave me their employee ID number, which I used to eventually match to their client outcome data. The specific client outcome data that I got was the Partners for Change Outcome Management System, which consists of two client-rated feedback measures. One is the session rating scale, and it's completed at the end of the session by the clients, and it ranges on a 0 to 40 scale. And the second measure is completed at the beginning of each session, and it's the outcome rating scale. And it's also on a 0 to 4. Both of these measures are very brief. They are only 4 items each. As far as how I analyze my data, I use bivariate correlations to look at the relationships between the therapist's characteristics. And then I use multi-level modeling to look at the extent to which the therapist's characteristics were associated with the client-rated outcomes. Specifically, I used a 3-level growth curve model because I had sessions nested within clients, nested within therapists. So I started my multi-level modeling by running 2 unconditional models so that I could, one for the SRS and one for the ORS. I did this because it allowed me to look at the variance that was attributable to the therapist. As far as the results, there was a strong negative correlation between professional self-doubt and counseling self-efficacy, and this was not a surprise given if we look at the definitions for these two constructs. Professional self-doubt is doubts about one's ability to effectively help clients, whereas counseling self-efficacy refers to beliefs about one's ability to effectively help clients. As far as the results of the multi-level modeling, specifically the growth curve, the results of the unconditional model for the SRS actually indicated a lack of overall growth. Specifically, the SRS, the overall mean initial status was 38. And if you remember, the scale only goes up to 40. So scores on the SRS tended to start high and stay high across treatment. For the ORS, I calculated an interclass correlation coefficient and found that approximately 5% of the variance and rate of growth for the ORS was between therapists. So we had significant variability among therapists. We also did have significant growth among those scores. So the initial status was about 22 for that out of 40. So there was actually room for those scores to grow across treatment. I won't go over all of the models that I ran, but the most interesting model that was shown was that when controlling for the effects of counseling self-efficacy, professional self-doubt was marginally significant. Basically, what this means is that if we imagine two therapists 1 unit apart in professional self-doubt, the client who is seeing the therapist who is higher in professional self-doubt will improve at a rate of 0.06 faster per session than the client who is seeing the therapist lower in professional self-doubt. However, when we removed counseling self-efficacy from the model, meaning we were no longer holding it constant, professional self-doubt was no longer marginally significant. So the presence of counseling self-efficacy was necessary for professional self-doubt to be associated with clients' ORS scores. Overall, what these results find is that the relationship between professional self-doubt and client outcome is more complex than we originally thought. So previous research, or the majority of previous research, has indicated that professional self-doubt has a positive relationship with client outcome. And although we had a marginally significant result, it was not significant as in previous research. And so further research is warranted